thank you all for taking the time to jump on today. Very excited as today we get to welcome Lucas and Dr. Carolina from Tenza and Voxel Bioinnovation onto the call today. And yeah, we're very curious to hear their outlook of what's happening for them for 2025. So, for those of you who have never heard of Spring, we're an organization that exists really to change the world through innovation. And we do that through a number of ways. We do that with partnering with entrepreneurs to help them become investment ready and raise the funding that they need to go on and scale. We also do that with investors, angel investors, to help them learn about how to invest and support the startups to create the world that they want to live in. And then we also act as like a middle layer connecting both of these two groups and facilitating really cool interactions through community events as well as education. And so with Spring, our main focus at the collective, as this is part of the collective, is to help folks learn, to connect, and to invest. And so this is one of our series where we focus on helping our angel investor community and the broader community understand what's going on from our founders and understand what's going on in the investor ecosystem. And so for today, gives me great pleasure to introduce Lucas, the CEO and co-founder of Tenza Health. Lucas, maybe you want to pop off mute and just introduce yourself a little bit, as well as a bit about your company.
Yeah, for sure. Happy to share, and thank you for the opportunity, and really here also to learn and hopefully contribute and provide some insights. So thank you for joining at the end of the day here. Some of you in Montreal, so that's past dinner time. So a little bit about myself. What can I share? I'm an entrepreneur, biomedical engineer by training, and I started Tensor Health because when I was 23 years old, I hurt my lower back quite badly, resulting in 2 herniated discs, and hobbled around in pain for almost 4 years. It was a very depressing, frustrating experience. I was very disappointed with standard of care. But that being said, I did receive good care in the physical therapy clinic. But kind of the moment I was sent home, no one could give me that kind of a clear, measurable, actionable path to recovery or assure me that I would recover. So that's really what we're all about at Tensor Health. And maybe take a step back. Unfortunately, most Canadians and also Americans, over 50%, suffer from musculoskeletal injuries and musculoskeletal pain and go through a very similar experience that I just described. And so our mission is to help physical medicine providers extend care beyond the clinic to manage and engage the patient population, because we all know that the majority of your recovery, actually 98% of your recovery, is done outside the clinic. But today there's no tools, there's no way for therapists, providers to engage and manage their patients. So we're providing that software platform. It's an episode of care management platform that allows clinics to engage, manage, and then also help them achieve key practice objectives and improve their profit margins and revenue potential with various insurance reimbursement paradigms. And on the patient side, think of the app as like Duolingo for physical medicine. So we turn the recovery journey into a data-driven multi-level game. So the patient kind of knows where they are on the journey, what to do next, how far they are from fully recovered. So it's a very fun, engaging, informative guidance for the patient. And that's us in a nutshell. And I'll share a bit more about where the company is at today. We're commercially available in Canada and the US. So.
Wow, amazing, Lucas. Tons of questions that immediately come to mind, but we'll get into it in a couple minutes. And also wanted to introduce Dr. Carolina, CEO and co-founder of Voxel Bioinnovation. Take it away. Maybe you can introduce yourself as well as what your company does.
Absolutely. So thank you everyone for coming here today. I'm Carolina. My background is mechanical and biomedical engineering. So Voxel came as an inspiration during my PhD, foreseeing really I was actually using real human samples from the hospital, and those human samples, they were hard to obtain. And I thought there has to be a way to do this artificially, to create human samples that pharmaceutical companies can do tests, drug tests, and before making the decisions to test those drugs in humans. So Voxel was born out of that thought of creating human samples artificially. So our focus at Voxel is using bioprinting technology to create what we call human-like cancer tissue models. And the idea with these tissue models is to be used as a screening platform. What does that mean? Is giving that power to the pharmaceutical companies that are developing the different drugs to screen the different drug candidates into our tissues and have a more reliable measurement of those drugs in terms of efficacy, and make better decisions earlier on before testing animals and testing in humans. Our main differential is the fact that we incorporate blood vessels into our samples. So I have a mimicking here of our sample. So as you can see, it's the plastic model that we do, but it shows you the complexity that we can get with the samples in terms of vasculature. So that's our main differential. And I do want to say before I pass it back to you, Nathan, that Voxel has been around for 4 years, and it's a lot of hard work from a very, very talented group of people behind me that is making the vision that I had in my mind a reality.
Wonderful. Oh, thank you so much for that introduction. That's amazing. So we're gonna stop sharing. What I will do is I will, right now we'll just have a conversation with Lucas and Carolina. Maybe y'all can kick things off and talk a little bit about the major highlights of 2024 for both of your companies. Maybe for this one, I'll go Carolina first and then Lucas second. So major highlights of 2024 for your companies.
I think major highlights for 2024 for Voxel was definitely a very good year for data. That was our major year of data, where we gathered the most impressive data that we have so far, and that was 2024. And again, a very hardworking group of scientists that made that data possible. So I think data is one of them. The second one is key hires. So we had some key hires in 2024, especially on our BD team. Graham is here somewhere. The idea with that, it was really to put us, the company, in the path for this year, which is focused on moving from R&D into revenue generation. So data and key hires were definitely the main 2 points of 2024.
Amazing. Lucas?
Yeah, so in many ways, 2024 for us was kind of like our first commercial year. And probably the thing I'm most proud of the team achieving is we had like a breakthrough over the summer. So we're B2B SaaS, so we sell software into clinics, and these clinics and these providers, they're super busy, they're overworked, many of them are burnt out. And so change management is very challenging. So you really have to make it super easy to operationalize new innovation, new software in existing workflows, whether it's operational workflows or clinical workflows. And we actually achieved that over the summer. And since then, we've grown, our patient volume has grown 10x. And so which is, so pretty much we have PMF at our doorstep, I would say, product market fit at our doorstep. We booked over 300,000 in revenue, and we ended up closing kind of an oversubscribed $2.2 million seed extension pre-Series A round right at the end of December. So it was a great way to end the year. And we're now treating patients in Nova Scotia and Canada as well, which was, I thought, really impossible to do that in the Canadian environment. But we are actually doing that now, which I'm very happy about. And we have a lot of traction in the US, but it's easier in the US for many reasons. So in a nutshell, yeah.
Amazing. It's always heartening to see. I mean, we're not founders. Some of us maybe in the call are founders, but it's always heartening to hear your stories and hear how even a year that looked up and down, there were a lot of progress for both of y'all. So kudos to both of y'all and your teams. Um, I guess I'm curious about um, shifting gears, leaving 2024 behind, focusing on 2025. What are some of the big focus areas for both of you as you continue to grow and scale your businesses? Maybe we'll switch this time. Lucas, if you want to go first, and then Carolina after.
Yeah, so for us, it's patient volume, patient volume, patient volume. It's like just keep that growth going. Hopefully get a minimum 10x from where we end in December and next December. Have really clear line of sight on break even from our end. Those two, and there's a lot of details, a lot of nuances to achieve those two milestones, but that's what we're predominantly focused on right now for 2025. And I'm excited. I'm super excited for many reasons. But yeah, I can put that for a Q&A.
I think for Voxel 2025, that's our growth year. So that's our transition from R&D into commercialization. So there is a lot of focus on really getting that traction, doing something with that traction that we are doing and that we are getting, generating revenue is the main focus for 2025. And of course, making that vision that I had in my mind and that the team is helping me to make that real, making that vision even more real, making sure that all the key hires for 2025 are really aligned with that mission and vision behind Voxel, and making sure that we are in that growth path is 2025.
Awesome. So it sounds, I mean, it's fair to say that both of you all are focused on revenue and focused on growth, as I think most companies are. I'm curious to know when you're thinking about focusing on revenue, what are some of the areas that you're really trying to maybe avoid spending time with? So revenue obviously means getting out the door, pounding the pavement, and selling. But some of that, I'd imagine some of those conversations can go in different directions. So any thoughts onto areas where you're willing to avoid spending time in?
I don't necessarily know areas that we are trying to avoid. I can tell you that we are trying to get to the no or to the yes, but especially to the no faster, because that saves a lot of time. We have a lot of people that are interested on the technology, but we want to get to a point where we are really spending our time carefully. We are not a very big group of people. So getting to that no faster, getting to the process where we are screening the people that are really interested and spending our time with the people that we believe or it's going to generate revenue dollar amount, or it's going to open the doors, because it's not necessarily just about dollars, but it's also about having that perfect partnership that we can gather data that will then open more doors. So getting to that no faster and avoiding those conversations that go around and around for a long time is definitely something that I'm quite conscious in 2025.
Lucas?
Yeah, I mean, I couldn't agree more, Carolina. It's like, you know, the way we say it at our company is just staying disciplined. We have a very specific ideal customer profile, and it's pretty much a filter to say no to prospects that don't match your ideal customer profile, to, you know, share maybe with a bit more focus. Like, we have an early adopter score. So the problem with us is attention, right? I mean, the whole world, that's the biggest commodity. Like, that's the most precious thing in the world today is attention, right? So, you know, making sure we're spending the limited attention of providers, to the right providers, and then getting to know as fast as possible, and ensuring that they're enough of an early adopter for our current product maturity, our current resources at hand, and the bandwidth of our team. So, and yeah, so filtering through a lot. And healthcare is very interesting that way because many of them are not early adopters. You know, they're kind of in the later stage of adoption curve. They like for it to be fully proven out before they jump on board. So navigating those waters and staying disciplined, and you know, a nice person is not necessarily a champion. A champion is, let's kind of say, is like someone who can get you in front of the economic buyer, who owns the P&L, who can sign off a contract. That's a champion. person who gets you there or that person themselves. Otherwise, they're just a nice person wasting your time. And so,
Yeah,
I've learned
yeah.
so much.
Yeah, exactly. It's interesting that both of you all are in healthcare sales, and healthcare, as you quickly mentioned, Lucas, is historically just been very slow to accept new technology through that. I'm curious if you have maybe seen a shift in market conditions 20 into 2025 in the healthcare sector. Are the buyers any different? Are they starting to be more receptive, less receptive? I don't know if it's too early to tell. I'm kind of curious to understand, what are you all seeing on the ground when you're actually talking to some of these healthcare providers, hospitals, the like.
Yeah. Happy to jump in.
Yeah, sure. Lucas, maybe you
Yeah.
go first.
This let me take a step back. So in the US, we are fully reimbursable. In other words, clinics make money with us. So insurance pays clinics to use us. And this reimbursement paradigm is called remote therapeutic monitoring, not to get into many details. It was introduced in 2022. And I would say by Q4 of last year, we went to our last conference in October, and about half of the attendees of that conference had heard about this new reimbursement paradigm. So I was very excited about that, because a year before that, no one had heard of it. And so, we're first mover advantage to a greater extent. So I'm excited about that. Now, that being said, independent of one's political views, with the new administration and the freezing of a lot of things, I not entirely sure, like USAID has been frozen all over, all NIH grants across the board. So Carolina, I'm sure you have your fellow scientists in the US scrambling right now. Basic science is not being funded at the moment. It's frozen. So I wonder if that kind of culture will also affect CMS, which is Medicare, Medicaid, pretty much what sets the rules for health insurance. The Secretary of Health, RFK Jr., is I don't want to say this on a call, but it could be considered controversial at times. And so we don't know yet. It's been a week since the administration has been in power. And so we'll see how that plays out. That being said, I'm very excited about our Canadian traction, because in Canada, there is no financial incentive to use us. We are improving access to care. We're improving patient outcomes. Nova Scotia Health Authority wants us to be the standard of care for the entire province. And so we
Which is
are.
huge. Congrats.
It is huge.
Yeah. So we are solving a problem at the global scale in many ways, right? And practically, so I don't want to digress too much and stay concise here for a second, but I'm excited. At the same time, keep an eye out on the news. But I think with every crisis, there's an opportunity, right? And if you're solving fundamentally a problem that exists in different economies in different countries, then we're in a fortunate position, So that's how I would look at it. So I'm excited for 2025 in many ways.
Yeah, well done, Lucas, with Nova Scotia. Congratulations on that. Yeah. So I think on the grants, we learned it today. So we applied for a lot of US grants, and we just got some not very nice emails today saying we are unable to provide a definitive date. Everything is frozen. So that's kind of sad. A lot of what we do at Voxel, we rely on non-dilutive grants, because we are building equipment, so we are building real product, which means that takes a lot of money, right? And we have been doing well with the dilutive part, but the non-dilutive is always a great incentive to anyone, any shareholder even of Voxel. So I would say that's something that we have seen a change today. Already, we have been notified. In terms of customers, it's too early to say. Our customers are pharmaceutical companies. At the end of the day, I think it's not necessarily how much the new administration, whether that is Canada or US, how is that going to play, but it's more on us to show our value with solid data. I think the moment we have even more solid data, I think adoption will be there. So the team is working very, very hard to add to that data and to make the company even more attractive to potential customers.
Thanks for that from both of y'all. I think one of the things I take away from that is that even in the midst of a changing political climate, it seems like the economic incentives still needs to be there across the board for customers to purchase, and it sounds like that's something you both of you are actively working towards, which is always a great sign in founders and in companies. So kudos to you all for that. One of the other things that popped into my mind is that as you talked about non-dilutive grants and funding, I guess maybe you all can talk a little bit about fundraising goals that you all have for 2025, if at all. I know, Lucas, you just managed to close your seed extension, so maybe not as a bigger priority, but curious to know about like fundraising goals that you'll have for 2025. Maybe Carolina.
Yeah, I can go first, and Lucas, I don't want to speak for you, but we are always fundraising. So that is, it doesn't really matter if we just closed a round yesterday, we are always fundraising. So that is like 100% of the time, any day. So Voxel we have raised close to 8 million so far in these 4 years, and right now we are getting ready for our Series A. So Series A is going to open at fall this year, and the hope is also to close this year. But our Series A is what we are aiming something around $10 million, and the goal for that round is really growth capital. That round is to increase our facility space, is to increase the equipment, to increase our capability of printing tissue. Our goal is to get to the point where we are printing 4x the capacity that we are right now by 2026, and increase the team, because all of us, including me, we wear so many hats, and we want to get to a point where we have people really, really focus on their tasks. So increase production capabilities, increase space, increase the team, focus on automation to speed up a couple of things. So that's our growth round that is going to come at the end of the year.
Yeah, so couldn't say better than that. I am actively fundraising, so always. We haven't opened up the round, it's all about language and how you position it, but I am actively speaking to investors for a priced seed round, which most likely will open up like end of Q1 into Q2. And what else? Yeah, pretty much what was our fundraising goal. So I'm looking at you're looking at a $3 million round this year, practically. Yeah, and it'll be a priced round, equity round. And we've raised 7 million to date. So 2 million in grants, 5 million in investor capital. Yeah.
Awesome.
Yeah.
Awesome. Okay. So just a few more questions. Really curious to know from both of you, what are you most excited about in 2025? When you kind of look at your crystal ball and you say, a win in 2025 that sets me up for 2026, what does that look like for both of you?
Yeah.
Maybe Lucas, you want to go first?
Yeah, I mean, for me, it's really 3 things. Well, really one thing: activating more therapists across both geographies. So we would love to expand, and we are in final stage of procurement with a couple other health authorities across the country. So very excited about that. But I do want to expand across Canada, because my goal is to be the standard of care for outpatient rehab for the country. And then also activate more therapists, which means ultimately way more patients on the platform concurrently being treated and managed. That's what I'm most excited about. And everything else, fundraising is really an outcome of traction. And so really just building out the business, line of sight to profitability, and be able to treat just 10x more patients, really. That's what's exciting for me.
Yeah, I would say on Voxel, a big win would be really get to a point where we are confident that we have found the right clients. And I don't necessarily even mean in terms of generating dollars, but generating the the partnerships opening the doors for 2026 to hit the ground running. So really finding who those clients are, who those customers will be. It's one of the things that I'm quite excited for 2025. And also we are hiring right now. So we are hiring two key new people for the business team, and we are hiring technical team members too. So getting to a point where we are seeing, hopefully by the end of the year, looking back, that we have made the right decisions, that the team is clicking, in that growth is happening. It's something that I'm also excited about.
Yeah, exciting. It's growth is it. Which probably leads into my next question. If you had to use one word, like some people like a mantra of here's the thing to focus on. I'm kind of curious, like what's the one word that comes to your mind personally and professionally that you're focusing on for 2025?
Professionally, I would say revenue or growth. That's where we are focused 2025. That is this transition, as I mentioned, from R&D to commercialization, which is it's a scary transition. Our team was highly technical, so we're slowly adapting now, absorbing a BD team. So really working technical and BD at the same time. So that has been a lot of adaptation inside of the company, but also a lot of new learning opportunities. To be quite honest, we have been learning a lot. So growth or revenue is my word for Voxel. My word personally, it's probably, that's a weird word, but I'll say it's gut. It's going with my gut. And I think 2024, I knew what was right most of the time, and I did not go with my gut. And I have a lot of people in my team that are here in the call that always keeps reminding me to go with my gut. So 2025, that's hopefully the year for that.
Awesome. That is exciting stuff. Lucas?
I can't subscribe to one word, but maybe like a sentence or two. So, and these will sound like platitudes, but less is more is really like, I'm really trying to drill that both personally and professionally. And slow is smooth and smooth is fast. So that's something that is like on the sales marketing side, we really are focused on. Like we have a bit of breathing room right now. Let's make sure we're planning properly and executing what's the term, like really execute with be deliberate, be more deliberate in execution. Right.
I love that. Yeah.
Running a company, a healthcare company, it's like life and death every day, right? So it's so now we have a bit of breathing room. Yeah.
That's cool. It's I get like focus on the essentials, be intentional. Then I also hear, focus
That's the
on,
word, Nathan. That's the word, intentional. There we go.
mind meld.
Thank you.
We got each other. And then focusing on revenue, and then focusing on trusting your gut, trusting your instinct. Those are really powerful things I think we can all take away from both of you. And then last question before I open it up to the audience. How can our investors help the people on the call? How can folks help you get to your 2026 looking like, wow, that was an amazing success? If you have any specific asks, I guess now's your time to do that.
I would say on the Voxel side is spreading the word, spreading the hard work that we have been putting into creating this cancer samples to accelerate the drug development process, and really just spreading the word out there, whether that is to investors or to colleagues, or to people that just want to know more about Voxel, or to people that want to apply for jobs that we have at Voxel. Spreading the word, I think it's something that means a lot, and it goes a long way.
Assuming most folks are based in Canada, my one ask is if you're going through physical therapy at the moment, or if you know someone in your a loved one, a family member, or a friend that is going through physical therapy, please let them know about tensorhealth.com, or if you're speaking to your provider, just putting tensorhealth.com on their radar. would be super helpful. So again, if you're doing PT and you want to improve that experience and have a more effective recovery, please introduce them to, just let them know, plant that seed. That's all. That would be my ask.
Amazing. Okay, wonderful. So right now we'll maybe take 15 minutes. I'll open it up for Q&A. If anybody wants to maybe pop off mute, put their hand up, and then we can go and highlight folks and let them ask their questions directly to Carolina and Lucas. Graham?
Pick me. So loved listening to you both speak through the challenges and like the exciting parts for this year. I'm curious because you have two different ones, software. Carolina, you're of course much more sort of hard tech. You're at a point where you're meeting more and more, you especially Lucas, like ramping up on customers. Carolina, you're going to be generating revenue too. How do you think about the levers on ongoing tweaks and development to the product versus getting out there and selling what you have? I know this is like a constant tension, and that tension I think changes as the capital markets change. And so really curious and hearing from you like how you manage that tension forward.
It's not even just the market changing. It's also the fact that we have a group of very, very talented scientists and they want to do everything perfectly all the time. And so it's like managing that expectation of it's not going to be perfect the first time. We need dollars in to come in. So I have been getting help a lot from the business team to push on that. That is that perfection is no longer needed. It's about getting the product out there. It's about getting the feedback. It's about getting better, but really based on what the customer believes is what's the right way to go, not necessarily just the company, not necessarily just the technical people should dictate what is the next evolutions of the products at Voxel. So really, I think the customer tests and provide us some feedback and really accelerating that, because otherwise we do go in rabbit holes, and we have been some of those, but I think we are getting much better at identifying when we are leaning towards going to that rabbit hole and being to the point where we're like, okay, is that really needed? So that constant communication with the technical, with the business, with the management team to make sure everything is pushing towards really getting this out of the door, but making sure that whatever is getting out of the door has been triple checked. It has a very high seal of quality, and it will provide the results. So we have data to back that up that will provide the results that people are expecting when they are using the samples.
So that's interesting. You find it's your own team putting you down those rabbit holes rather than customer requests being like,
I think it's both. Like the team is not that they are putting us to the rabbit hole. The teams sometimes they really want to understand everything that is going on into the system, and dealing with something as complex as the tissue model that we are creating, multiple cell lines, delicate samples. We don't necessarily need to understand everything if we are not pursuing that avenue anymore. So it's the ability to shift gears quickly and let go that project, which sometimes people do take very close to their heart, and I appreciate that. But that ability, and I think from a customer perspective, is really getting that feedback. But it's true, when we talk to customers, and if right now we have been having conversations, we finish our breast cancer tissue, there is more to do there, but what is next? What's the next issue? And every time we talk to someone, we hear something different. So it's being able to really focus on what's the goal that we are trying to accomplish and who are the voices that we should be hearing, and taking that as a higher level than other voices, depending on the customers that we are talking to.
Yeah, people talk about customer discovery as being all about listening, but it's actually about
absolutely
sort of listen but not react. Lucas?
Yeah, it's a very iterative process. I fortunately don't do that. My awesome co-founder Gautam leads that with our product manager Brian, and they do a fantastic job. And the way we look at it is we're in market already, so we know what the objections are already on the product to a greater extent. And so what we do with customers is we upfront share them, we manage expectations, and we tell them what's in the pipeline. Here's our product roadmap for the next year or so they can see that their concern or objection is going to be addressed in the future, first and foremost. And then when we work with frontline staff therapists, we actually have Slack channels directly with our clinics. And anyways, just a communication system that we have in place where therapists can request features and extra content right away from the team. And if it's within 24 to 72 hour, if the team can deliver within a 72-hour window on that without major rework, we actually do it. And that's really, I mean, that's because it's possible because of software, but what that builds is a lot of trust. So we use the feedback and actually delivering on the feedback again, if we hear it multiple times, not just once, and then we deliver on that, and that really builds trust with the provider because they feel like, okay, I'm actually being heard and they're delivering something that I'm asking for, whether it's in that specification or not, that's a detail, but we actually use it as a way to build trust with our customers. And that is been very, very powerful. We have incredible champions, people that are like, beyond happy with us and understand that the product is only doing 1% of what we want it to do, right? It still does we're just 1% there right now. And then showing the product roadmap and managing expectations. And then also sometimes saying, listen, like we cannot deliver on this right now. And if this is not, even in a sales process, if this is not the right time, and this goes back to qualifying the prospect, are they early adopter enough? Do they understand the pains that potentially will come with adopting this? And how do we minimize that and what the opportunity cost is for them? And being very, very honest upfront about that. So, and again, that builds a lot of trust with your provider, and they feel almost like, the other prospect I want to share is like, when we work with clinics, and this is really because my co-founder's mother's an OT who ran rehab day centers, our CCO worked in this industry for 30 years, but it's like when we operate in a clinic, the way we partner with them is how would we do this if we owned the clinic? And how would we minimize disruption? How we would not make it, a massive headache for anybody. That's the approach with clinics. We are actually true partners. Instead of just, here's a product, go run with it. No, that's not how we like to partner. So yeah, it's a constant battle, but it's very iterative. And then
yeah, nice. Thanks.
Thank you, Graham.
I'm curious if anybody else has any comments. I don't know if there's anything there in the chat. I guess I have another question that pops into my mind. It's one of the challenges that all CEOs have to face is that they're always raising. There's the sales aspect of it, founder-led sales. I'm kind of curious for you, what were maybe some of the strengths that you felt you had going into this as a CEO? And then what are some of the areas that you've then built a team around to support you as you continue to go ahead and do that? And then we'll take Olivia's question after.
Lucas, you're definitely going first.
Well, I mean, we're both biomedical engineers, so I think that background in STEM really helps because you have a lot of frameworks that you can, you used to work in operating in frameworks, so that's very helpful. But I think what I brought to the table was I've always loved selling, so I'm kind of maybe a little unique that way. I just love selling. Like that's something I just really I'm super passionate about. I grew up, my dad's a serial entrepreneur. I grew up selling at the age of 10 in our health food store chain, and I just love selling. And I think that was a little unique that I brought to the table. And two, I'm just curious. I'm a very curious person. So whether that's not really a strength, I would say. But those are two things that I brought to the table. Did I know what I was doing when I started? No. I had no idea what it meant to what it is to build a company, what it is to build a company in such a regulated space across borders with patients, providers, insurance, like, all the P's of healthcare. I had to learn all that, and I did that by bringing in an amazing co-founder who's commercialized technologies in the past and also knows the space inside out. And then my CCO has done this successfully with multiple startups for 20 plus 5 years with really big wins behind him. So, bringing those people together to address the gaps that I would have, that I have, or I don't have them anymore, but I had them at the past, I would say. Yeah.
Yeah, that's a great comment, Lucas. I would say for me it's fairly similar, although I don't love the sales part, even though it's something that we have to do naturally as CEOs of a company. I would say something that I bring that is a strength is my technical skills and my dedication. So that is definitely something that is a strength. I haven't yet got tired of anything, so I can easily pull very, very long hours, very consecutive days, and I believe that is something that the team really appreciates. Is I am accountable and I'm very reliable, so that's something that I bring to the table. Something that we are slowly building a team around. It is on that sales and that organization on the business and operations, because as Lucas mentioned, we start this and we are not really sure until you're in the midst of it and you're like, oh my God, I have to sort this out. And there is so much that I need to do and I don't even know where to start. So it's finding the right people to put on those roles. That is the business, the sales, the marketing, and everyone to guide us, this company moving forward, and to making sure that the company is protected, the shareholders are protected. That side is also very, very important. The legal and the IP is something that we got much stronger also with time, and it made such a big difference for Voxel.
I always joke, you almost have to be like you have to become a lawyer. Like you have to learn everything about finance too. Like you learn and you have to be better than the average person. Olivia, sorry,
Yeah.
cut you off.
Yeah, but that is my goal, Lucas. I said that the moment we exit this company one day, there's no hurry for that, but I will definitely go back to school and get a law degree because I learned a lot during this process. Olivia, it's good to see you.
Good to see you. Sorry, I've come off. Put my video back on, but this ties in really well to my question. Like you've got to be the HR team, you have to be the lawyer, you have to be a finance person, you have to do everything. So kudos, and of course you have to work really hard. So yeah, kudos to you guys. And my question was like from the perspective of investors, I think it's mostly investors on this call, and we're constantly asking like, how can we help? Maybe just shifting that question a little bit to like what has been helpful and framing it in the mind of you're both thinking about scaling your businesses in slightly different ways, and you're thinking about this year coming up. And I'm thinking about all the different consultants that I speak to all the time who focus on go-to-market and focus on sales. And I'm kind of curious, like thinking back, like who has been the most helpful? Has it been accelerators? Is it board members? Is it your teammates who filled gaps? Maybe it's a bit of everything. And then the other piece I was kind of thinking about as well is like, as you think of expanding, we touched a little bit on like the US and the challenges there. Who has been your go-to? Who has been helpful as you think about expanding to new markets? And I'm hoping that maybe we see some trends with your comments, and then we can go back and think about people we know in our networks that might be able to help.
I would say definitely for Voxel, the team, of course, they have been incredibly helpful, but so have been advisors. So I have been, since the beginning, being able to gather advisors that become official advisors of the company, or for example, board observers. So those are very, very helpful individuals. And we have that not just for me as a founder and CEO, but also for our technical team. So we have specific advisors that are there to support specific team members. And we do that in a very structured way. So we have like bi-weekly meetings and everything. So every advisor knows their time commitment to Voxel and what that means to Voxel. So that has been incredibly helpful throughout these years. And I think it also has been working with a lot of fractional people. Where I was in the beginning, I was quite against fractional roles because I was in the mindset that if people are not here full time, it's going to be quite hard. But the reality is fractional HR, fractional CFO, fractional people like that have been really able to support in a meaningful way when we would never be able to afford those full time, but they have been able to support the company considerably.
Let me see how I can answer this concisely. So I think it depends on, I mean, the way I look at startups with company building, it's like, you're peeling the onion. It's like I spend all day solving problems. I wake up, okay, what's the biggest problem today I have to solve, and then, move on. So it's like, I would say, depending on the problem, maybe an advisor is well positioned to help or provide some consulting or advice. Maybe it's a team, the team can step in if it's on the technical side or more kind of nitty-gritty detail on the sales motion. So I think it depends on the problem we're addressing at that point. But what's been most helpful for us as a company is advisors and investors who have been there, done that, but also learning how to manage that. And the thing is, most people don't spend any time thinking about my company. Most of my investors never think about my company. Like, they're busy with their lives. They have another bunch of other investments. Like, they get my update email once a month. It's a 1-minute read. Like, okay, you're alive. Good. Keep going. So, and so when you request help, there's just a lot of context that needs to be provided. So that's a ton of overhead for a founder, right? And so I always try to manage. If investors and advisors and even shareholders of the company are asking questions, you're taking precious time away from me operating and explaining that there's an opportunity cost to that email that I just received. And I think most people don't want to hear that. So, and so the advisors and investors have been most helpful actually understand that and will be very clear, like, this is a curiosity question. This is a question that I'm asking because I want to do XYZ with the information. And so then it gives me an incentive to prioritize that email, right? Helping me manage whether or not this is an important email. So, and then also with these investor advisors, over time, you graduate from them. Like, typically they last a year, maybe 2 years. But at some point, your knowledge that you've extracted from them, like, you're at where they're at and you need to move on and need to get the next level of expertise, not next level of experience to the table, and being truly honest about that with them, and then just say, like, this is in everyone's best interest. We're graduating. We're moving on to a new advisor panel, right? And so I know, Olivia, you're asking for specific industries or skill sets per se. I would say is what's been helpful is like getting on a call, pressure testing our thinking. What are the gaps? What are we missing? But understanding that if you want to advise a company, that person needs, every consultant needs to be managed, right? That's the biggest problem with consultants, is that they need to be managed and there's an overhead associated with it. And I don't have time to do that, like in many ways, right? Because I'm running, like, wearing many, many, many hats. So really understanding that as an investor advisor is like, you truly understanding how you can be value add and helping the founder not have that, what I call additional mental load. Yeah, so I know that was probably not where you're looking for, Olivia, but that's kind of
No, I think
how
that's helpful.
yeah, it's
Yeah.
we
parallels with
Mhm.
both of you. And I think it's interesting with Carolina, like having advisors, not just to the founder, Lucas. I think that's an interesting model that helps maybe solve a little bit of that, the opportunity cost piece
Yeah.
and the challenge of managing it. No, appreciate it.
Yeah.
Well, thank you, Olivia.
Awesome.
Sorry, did someone say something?
No, I think that's it. I know that one, it's pretty late for everybody, and so we kind of want to give back a bit of time. So what I'll just quickly do, I'll just share my screen again.
Maybe Nathan, maybe you can share what's your word, your
Oh, my
personal
one word
word.
of the
Yeah.
Yeah, that's a good question. personally, my one word is courage. And what that looks like is doing things that I definitely would not have done, like skiing, throwing myself down a mountain is something that I haven't done before. And I've gone twice already this year, so we're moving. And then I would say professionally is just flow, just to stay in flow, to continue to do things that bring flow and try to bring more flow into my work. Yeah.
I
Thank you.
see a question, Nathan,
Oh,
from
sorry.
Erin
Uh,
or Irene. I don't know if I'm saying that correctly. How do you answer forward-looking questions from investors when the world is so upside down right now? So if they're asking, maybe provide some clear context on like if an investor is asking about our projections or what our future plans are. I just to be more.
yeah, I guess
Mhm.
maybe I could take a stab on that.
All
Oh,
good. She
okay.
said we've answered it. Okay.
Thanks,
I
Aaron.
would say Aaron, transparently. That's the best answer for it. Like you do the best that you can, but you also show that everything is risky. And that's the reality of business. So just being transparent and sticking to what you know, and also making sure to not make any promise that you can't get to that point. So operating in a transparent way is my advice in it.
So that's really amazing. Thank you both of you, just for taking the time to share your thoughts, your reflections, your. I think one of the things I take away from this call is just one, how hard it is to be a founder, but two, that there's a way to do it that's both very thoughtful, that's also changing the world, really. Like both of y'all are creating products and solutions that can have a real impact, especially in the healthcare sector, can have a real impact on a large number of people. And so kudos to both of you for doing that. Just wanted to share what's coming down the pipe for spring. So really quickly, for those of you who are on the call that are interested in learning how to invest, we are running our 5th edition of the Women-Led Invest Together Challenge. It is our 20th Invest Together Challenge. And it starts February 5th and it goes all the way to April 9th for 10 weeks. If there is anybody on the call who is interested, feel free to scan the QR code or send me a message, nathan@spring.is. And I'm happy to chat with you more about the program and why it's amazing and why it'll change your life and why you can eventually fund the next Voxel as well as the next Tensor Health, because those are 2 winners of our previous programs. And again, if you need a QR code.
Yeah, I wanted to just do one closing statement, Nathan. I'd be
Sure.
remiss if I didn't take the opportunity, but I appreciate you, thank you for the kind words. But I choose to do this. So I'm privileged in many ways that I choose to do this. I don't have to do this, but I choose to do this. So I appreciate the kind words, but I'm one of the fortunate ones that's able to do this and choose to do that. So I want to just make sure that's clear to the audience.
Yeah, I mean, it's
Yeah.
I don't think any founder goes into any situation like building a company without no, I think it was described, it's like you're constantly eating gravel with your teeth.
Yeah.
So yeah, you're right. You did choose to do this, and it's a huge job and commitment.
It's not just choosing to do it, it's choosing to do it every single day, right? And that's like choosing to do it once, it's fine, but the challenge is doing every single day, and
Yeah.
can't let any personal life, can let anything get in the way. You just rinse and repeat every single day. So I think that's the kudos here. Yeah.
Yeah. Just Otherwise, I'd be bored, you know? So
I agree. I'm with you.
just to make it a
I love
little
that.
more light. Yeah.
That shows a real founder. A real founder is someone that's like, yeah, give me all the problems for breakfast and lunch and dinner, and let's go again.
Yeah, when things are too calm, they are worrisome. So yeah, it is true.
That's awesome.
Well, thank you for the opportunity.
Yeah,
Thank you, all of you.
Lucas. Thank you, Carolina.
Thank you.
And for those of you who just are on the call, just wanted to, last thing, we have a next webinar coming up on February 12th. We'll be talking about navigating the VC secondary market coming up February 12th. And we'll have Mariam from Pender Fund come and speak with us.
Timing is still to be determined as well for that, right?
That is true. Timing is to be determined, but we will, if you sign up, we will let you know as soon as we get confirmation on time. And that's all I had for you today. So thank you very much. Thanks, Carolina. Thanks, Lucas, for taking the time to come and speak with us. Yeah, thank you to all of you for joining at 8 p.m. on Eastern and 5 p.m. Pacific. I know that's not the earliest time, but really appreciate your time and your attention for this call.